Hi, my name is Taylor Neher, and I'm here to talk to you about estrogen replacement therapy and its carcinogenic risk in relation to FDA regulations. This presentation will talk to you about the overview and history, the background, hormone replacement therapy, alternative treatment methods, the carcinogenic risk, cancer prevalence, how the FDA views them, and then moving forward and references. A general overview of the history and definitions and concepts of estrogen replacement therapy. Estrogen replacement therapy is more commonly known as hormone replacement therapy, or HRT. It is utilized in older women going through menopause and women showing symptoms of menopause. However, in 2002, the Women's Health Initiative had a randomized control trial that noted an increase in breast cancer risk in those taking HRTs and challenging the world for further research on hormone replacement therapy. However, prior to this study, hormone replacement therapy was utilized largely by prescribers as a preventative medicine for heart disease, dementia, and osteoporosis, in addition to the benefits of menopause. In 2005, the International Agency on Research for Cancer moved hormone replacement therapies for menopause from a possibly carcinogenic drug to humans to definitely carcinogenic to humans. Background information: menopause is caused by aging in women and the lowering levels of estrogen in the body. This can include hot flashes, sleep issues, and vaginal dryness or pain. Menopause generally occurs between the ages of 50 to 60 but can start in the early 40s. 80% of women say menopause didn't decrease their quality of life, and 62% of women have positive attitudes towards menopause. The symptoms may last for about 5 years, and every year in the US, 2 million women reach menopause. Menopause is considered to be occurring when the final menstrual cycle has occurred, and postmenopause is once a patient has gone 12 months without another menstrual cycle. There are 3 stages of menopause. Perimenopause is when the start of the symptoms up to 12 months post the last menstrual cycle. Menopause is confirmed once a patient has gone 12 months without a menstrual cycle. Postmenopause is everything after those 12 months. We started treating menopause with estrogen replacement therapies in around 1982. And once you are in postmenopause, you have a higher risk for certain conditions like osteoporosis, coronary artery disease, and urinary tract infections. Hormone replacement therapy can occur in 2 main forms. There's systemic hormone therapy, which can be delivered by oral tablet, a pat, gel, emulsion, spray, or ingestion, and is to be circulated in the bloodstream throughout the whole body. ET is estrogen only, which is generally utilized for women that do not have a uterus. EPT is estrogen with progesterone for women with their uterus still to protect against uterine cancer. Local hormone therapy is targeted solely for the vaginal symptoms of menopause, with hormones being released directly to that area. And it can be a cream, ring, or tablet, and it does not help with the other symptoms of menopause. Alternative treatments for menopause. While the Women's Health Initiative consider all drugs to help with menopause, including the natural or bioidentical compounds, to have the same risk factors, there is an alternative to hormone replacement therapy that's called bioidentical hormones, or BHRTs. They are custom made to an individual's body but are not reviewed by the FDA currently. They are made by homeopathic doctors or pharmacists, but all the claims made by them are unproven to date, and the FDA is currently working hard on getting all of these compounds reviewed and removal of any false claims associated with them. There's currently no data to support them being effective or equivalent to currently approved hormone replacement therapies. The carcinogenic risk, since the original findings of the Women's Health Initiative 10 plus years ago, the research has developed a lot on the true risk of hormone replacement therapy, still proving that there is a risk of cancer, but the risk is very minimal for women under the age of 59 who take it within 10 years of menopause while following all of the recommendations put forth by the FDA. These are some of the risks to consider. There is a risk for stroke with both the ET and EPT therapy options, risk for blood clots with hormones consumed by mouth but is very minimal in women 50 to 59, uterine cancer. If you still have your uterus, it is suggested to take EPT because the progesterone prevents uterine cancer. If you've already had uterine cancer, it is not advised to take any estrogen replacement therapies at all. Breast cancer, ET therapy methods have shown minimal risk until you have been taking it for 7 years, and the risks increase. And these risks increase more with EPT therapy methods with 3 to 5 years. Here is a little infographic about hormone replacement therapy and if it is for you, starting with, are you experiencing menopause symptoms in general? And then, have you ever had breast cancer? Are you at a high risk of venous thrombosis? And if you have a high risk for cardiovascular disease. The prevalence of cancer with hormone replacement therapy is as followed. One study with over 8,000 breast cancer cases on individuals that were currently on ET replacement therapies had a relative risk of getting breast cancer of 1.14 with a confidence interval of 1.05 to 1.22 compared to the controls, with individuals that were formerly on ET therapy methods but were not currently with their breast cancer had no increased risk of getting breast cancer with a relative risk ratio of 0.98 with a confidence interval of 0.91 to 1.05 compared to their controls. However, in one study with over 17,000 individuals, those who are currently on EPT therapy methods had a risk of getting breast cancer of 1.76, the confidence interval of 1.56 to 1.96 compared to the controls, and individuals formerly on EPT methods with a relative risk ratio of 1.06 with an interval of 0.93 to 1.12 compared to the controls, which this is just showing that those currently on a therapy method have a much higher risk of getting breast cancer, while also showing that EPT methods have a much higher risk than ET methods with a relative risk ratio of 1.76 compared to 1.14. The cancer prevalence in a study done in 2005 shows that out of every 10,000 women per year taking EPT therapy methods, there would be 8 more cases of breast cancer, 7 more cases of heart attacks, 8 more cases of stroke, 18 more cases of blood clots in the lungs and legs, and 23 more cases of dementia in women over 65 years of age. How does the FDA view this? Previously, the FDA viewed hormone replacement therapy as a good drug for preventative medicine. It was Approved in 1942 by the FDA as a drug treatment for menopause with DES. In 1991, the FDA Advisory Committee voted almost unanimously in favor of an industry request for an indication for ET for reducing the risk of CHD in postmenopausal women, along with osteoporosis and memory prevention, and utilizing hormone replacement therapy as a preventative medicine for those things, in addition to its menopausal benefits, and was almost prescribed to all women over a certain age as a preventative medicine. However, since the results have come in showing the carcinogenic risk of hormone replacement therapy in older women, the rates of prescribing these medications for long periods of time and as a preventative medicine have decreased greatly. Now, generally, women are already only kept on the treatment methods for 3 to 5 years compared to much longer periods prior to 2002, with close to 10 plus years on the drugs. No longer recommended as a preventative medicine in aging women for things such as heart disease and memory loss. However, it is still considered a preventative medicine for osteoporosis, but there are other medications that are generally better for the patient given their medical history and risk factors. The FDA is continuing to support further research on the risks and post-surveillance monitoring of hormone replacement therapy, along with regulations of labeling and warnings. The prescribing recommendations begin with using the lowest dose possible until finding one that works for the patient, and only prescribe it for the time necessary to minimize the risks as much as possible while also reducing the symptoms of menopause. It is important to look at a benefits-risk ratio that are favorable to the individual to initiate treatment closest to menopause age. However, the risks of cancer and side effects do increase with age. So it's super important to look at timelines and how long a patient will be on the treatment methods. With all hormone replacement therapies, according to the FDA, there's now required to follow a black box warning label noting the adverse risks associated with hormone replacement therapy and everything you can do to prevent them. Overall, individuals are very different and all have very different risk factors with family history of cancer, lifestyle choices, and benefits, along with the differing reactions to hormones and hormone requirement levels. So it is incredibly individualistic to treat and important for a team to look at it as a whole. Here are the drugs currently approved by the FDA with estrogen in indication for both vasomotor symptoms and vaginal atrophy, with pills, skin patches, topical creams, gels, topical emulsions, and vaginal rings. These are the drugs currently approved with progesterone as indicated for managing estrogen-induced hyperplasia versus indication for only contraception. So these drugs are also used for contraception, but are indicated for good for menopause as well, with oral pills, intrauterine devices, and vaginal gels. And here are the currently approved FDA estrogen progesterone or estrogen testosterone combinations, which are utilized for both the vasomotor symptoms and vaginal atrophy with oral pills, transdermal skin patches, or injection. Overall, it is found that hormone replacement therapy is a great benefit to healthy women that are without an increased risk for cancer, and it outweighs the potential risks when utilized and noted as described by the FDA, the North American Menopause Society, and the American Society for Reproductive Medicine, and the Endocrine Society. Hormone replacement therapy, while poses risks for cancer, is a great tool to utilize when prescribed correctly. Here are all of the references for everything noted in this slideshow.